we set out to find out budgetary allocations, releases and disbursements for immunization. What we realized was that at the national level, government expenditure on immunization, routine immunization and vaccine procurement constitutes just about half of the total funding for immunization, which suggests that our donors are funding immunization more. And we think that at this stage in the life of our country, we should begin to work hard towards taking full responsibility of immunization of our children, because come what may, in some few years to come, we will exit the Gavi plan, and it means that we have to fund immunization 100% from our internal coffers. So the earlier we begin to practice that, the better it will be for our children and to maintain gains that we have made as a people in terms of coverage of immunization. At the district level, once it is budgeted for by the DHMT and incorporated into the composite plan of the district assembly, the likelihood of having funds released for immunization is high. But as we saw from the presentation, these are very low amounts, between 1 and 4% of the health budget of the district is given to immunization. And we are not saying it's low. Inferring, the districts themselves have said that it is inadequate and unable to help them to undertake their immunization activities as they wish to. And once they have inadequate funds, it impacts their coverage in terms of targets that have been set for them to cover a number of children. So it affects their targets, because staff are unable to move out. They need the transportation. Staff must be constantly trained to be abreast with, diseases that are breaking out. They must have their backpacks or logistics that they need to work with. If they do not have it, they will not be able to be efficient in their work, and that will impact on the number of children we reach. We have made gains as a country. We want to either maintain or move ahead, and so whatever it takes for us to cover every child, because according to the SDG, no child should be left behind. And so for us to move ahead and not leave any child behind, we need the resources. If government is contributing just half of what is required, then we encourage government to increase what it gives, and whatever is allocated, government must also keep its commitment by releasing the fund and ensuring that the staff are using it for the intended purposes and they are attaining the results. If you don't release the funds, you don't expect the health staff to perform magic to achieve the targets you have given them.